Knock, knock. Good evening. My name's Claudia Garcia, and I'm going to be your SVN for the evening, okay? So today we're just going to perform a regular newborn assessment on your beautiful baby boy, okay? Is that okay with you? Awesome. So yeah, this is just routine. We just want to make sure everything is fine with him. So first I'm going to start by I'm giving us some privacy, so I'm going to shut this curtain. Okay, and I am going to verify your son. So here we have baby boy Garcia, and may I see your wristband, ma'am? Okay. Oh, your name's also Claudia. Okay, so Claudia Garcia. Okay, awesome. Okay, so what I'm gonna check is that your baby is in the appropriate um setting. So his crib is fine, his rails are fine, so perfect. Everything is checking out great. And oh wow, aren't I just lucky? Your baby is so sound asleep that he's gonna make this too easy for me. Okay, so the first thing I'd like to do is I'm going to lower the crib so it's at my waist level, okay? Perfect. And I'm just gonna assess his breathing, and he's breathing at a regular rate, so that's good. And now I'm just going to count the heart rate, okay? So okay, so the heart rate is at 110. I know that may sound like it's high, but that's absolutely normal for an infant, okay? So no worries. And now I'm just going to check his little temperature, okay? And I'm going to do it through the axillary, through his armpit. Okay, and this is the thermometer. Beep beep beep. Awesome. So the temperature is 115, so that's good. We want the temperature to be anywhere between 110 to 160, and his is 115, so that is great. And I'm going to do a pain. I'm going to be assessing his pain to see if he has any pain, okay? I know it sounds strange that a newborn could possibly have pain, but we never know. So we're going to use this method called the FLAC scale. So F stands for face, legs, activity, cry, and to see if he's consolable. So we are going to check his face, and he has no expression. He's sound asleep, so he will be getting a 0 for that. And his legs aren't moving. He's tightly wrapped in his little burrito, so that's another 0. And he's sound asleep, so his activity is quiet, so that's another 0. And he is not crying, so he gets another 0. And he looks very relaxed, so he's very consolable, so that's another 0. So this is perfect. This is what we love to see. So typically what we do is we add up the numbers, and let's see, so FLACC. So we add up from the 5, and your baby is at a perfect 0, so he has 0 pain, so that is absolutely great. So now what I'm gonna do is I'm just going to put my hands on your baby, okay? So I'm just gonna put my gloves on. And I'm just going to be checking his head, okay? So his head, both sides match, so that means there's symmetry, perfect symmetry. And there's a little bit of molding. So molding is like, you see how it's a little like cone shaped at the top? You see this? That is perfectly fine. So So the head, so it's so soft, and it just like molds that way due to when the baby came out, from the vagina, it squeezed a little, but that's absolutely normal. His head, no worries, he will not have a cone head all his life. This is absolutely normal. It will round out eventually, okay, ma'am? Okay, and now I'm just gonna check for the fontanelles. So these ones are soft, and the back is soft. So this is what um, typically everybody calls the soft spot, and having a soft spot is absolutely normal. So just try to not push down on it, okay? Just be very cautious. Yes, oh, so I'm glad you know not to push down. So, okay, so now I'm going to look at your baby's beautiful face, and everything seems to be very symmetrical. His face is just so adorable. Okay, and now I'm just going to take a little peek at his eye, okay? I'm going to open it, and the sclera is white, and on this side too, so that is good. And oh wow, perfect. So your baby just blinked once, so the blink reflex is perfect. And let's see. So his eyelids are prominent. I'm sorry, his eyelids are not prominent, so they are not bulging. They are perfectly fine, and his eyes are leveled to his ears. So, that's also a good sign. If his eyes weren't level to his ears, we would be afraid. Well, not afraid, but this could indicate Down syndrome. So you don't have to worry. And so right now, it would be nice to check for her eyes. Like I would be using a pen light, but I don't want to wake him up. So we'll check for Perla a little later, okay? So now we are going to check the ears. And the ears, like I mentioned earlier, they are perfectly symmetrical to the eyes. And we're just going to be bending the ears to check for recoil. So here we are bending, and it goes right back, and we are bending, and it goes right back. So that is perfect. And we're just going to check that there aren't any growths, like, just abnormal findings. And this one is nice and clear, and so is this one. So awesome. And now we are just going to check that the nose is nicely midline and symmetrical on the face, and it is perfectly fine. And now don't be alarmed, okay, ma'am? I'm just going to plug up your baby's nostrils one at a time. Perfect. And now we are just going to check for the lips. Is there nice symmetry? Yes, so they are equal. And I'm just going to check for this little part. It's called the Cupid's bow. Oh, you know that because of makeup? Okay, so we are going to just check the baby's Cupid's bow, and it's right there, present. Okay, so we are so perfect. Yes, so the Cupid's bow is great. So now I'm just going to switch out my gloves, because I'm going to be putting a finger in your baby's mouth, okay? Okay, so now that we checked his lips, I'm going to put my finger in the mouth, and the baby, wow, he has a very strong suction. That is great. And now that your baby is suckling on my finger, I'm just going to check for the palates. And they are intact. And I'm just going to take a little peek. And You see how the insides are pink? That's exactly what we want to see. We want to see nice pink mucous membranes. Okay, so now we're gonna have to unwrap baby. I apologize if he cries, okay? Okay, so I'm going to unwrap the baby. And I'm going to look at his skin color, and it's nice and tan, and it looks just like yours, ma'am. So his skin color is perfectly fine, and we're just checking if there's any abnormal coloring. A lot of times infants have acronosis, so that is when only like the tips of the fingers and the toes are blue, but your baby does not have that. He is perfectly fine. He's tan with a little pinkish undertone, so that is good. And you see this little white stuff like here and there? That is perfectly fine. That will just wash off in the bath. That is called vernix. And I'm just going to feel for his temperature just lightly, and he is warm. I'm going to check his nails. They are not clubbed. No, okay, so they are average, and I'm just going to pinch a little finger, and I'm going to check how fast for this thing called cap refill. I pinch and I see how long it takes for it to get its color back, and 3 seconds, so that is perfect. I apologize, that was 4 seconds. Let me redo it. Okay. It is 1, 2, 3, 4 seconds. Okay, and now, sorry for that music. And so now I'm going to check the baby for lanugo, okay? So lanugo is this fine hair that just babies have. It's either found on their shoulders or their back, and it's completely normal. So I'm just gonna check if your baby has lanugo. So let's flip him over a little. And no, he doesn't have any, so that's okay. It wouldn't be bad either if he did have lanugo. And now I'm just gonna check for his neck for range of motion, and you see how he's moving his neck, just being a little explorer. Well, that is perfectly fine. And now I just want to check his clavicles, check if they're bumpy, like are they uneven, or then they are nice and smooth. And now I am going to pull your baby up. I'm just going to hold him by his hands, and we're going to see what happens with his head, okay? So you see how I'm pulling him up and his head is like not coming up as fast? That is known as head lag, and that's completely normal. His head is a little heavy for his body right now, and he can't really control it, so that's completely fine. And now I'm just going to be listening with my stethoscope, okay? I'm going to be locating 4 sounds. I'm gonna make sure that it's nice and warm because it might be cold, and we don't want to startle him. So we are first going to check the aortic. It's second intercostal space, and then the pulmonic on the second intercostal, the tricuspid, and mitral. Perfect. So that is perfect. So I heard the brachial and the femoral are present. Okay, so now we typically we would want to do breathing after, but I took advantage and monitored his breathing while he was asleep. And what do you know? I didn't even have to do that earlier because you have such a fantastic baby. So, but we got that out the way. So now we're just going to check his chest. We are checking to see if it's normal or barrel chested, and it is normal. So his chest is normal. And we are just gonna see his nipples, and they are nicely aligned. They are two. And I'm just gonna feel his breast or chest, and they are nice and flat, not engorged. And his little tummy is nice and round. His little stomach is nice and round, and I'm just gonna give him a little pinch. Okay, it's not gonna hurt. I just want to see how fast it goes back to normal, or if it doesn't go back to normal. So here we're gonna check. That is called skin turgor. So we're going to check, and if the skin would have stayed up like this, that would have been known as tenting, and there isn't any, so that is good. And now I'm going to check for his bowel sounds. We're gonna do a full minute, and we do it on each little quadrant as such. And his bowel sounds are active. And now I'm just going to touch, palpate. Perfect. So as far as urine, your baby is gonna tinkle within the first 24 hours of birth, and he's gonna make his first little poo in 24 to 48 hours. It's gonna be dark and a little sticky, nothing like you ever seen before. Don't be alarmed, that is completely normal, and it is called meconium. Okay, and so now we're just gonna check his umbilical cord. It's nice and fresh. There's no discharge. It's not green. It doesn't smell strange, so that is looking good. And right now I'm just going to check for his penis, and everything is fine. He isn't circumcised, obviously, but you could get him circumcised if you believe in it. If you don't, that's also fine. And I apologize. And he has his little scrotum is has a little rugae, which is completely normal, and his testicles, they're attached. They're not like descended. And the anus, let's look at the anus, is perfectly located where it's supposed to, and there isn't any sign of a black stool, so that is fine. And so now we're just gonna count. So now we're gonna count the fingers. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 10 fingers, and now we go to the toes. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So 10 little toes and 10 little fingers. That's awesome. So now I'm just going to bend his little arm. I'm gonna bend his little hand toward his arm. And you see how he was able to do that? That means he's a full-term baby. And now I'm just going to wrap his little arm like a scarf. And so that's good. That's the sign of being a full-term baby. And now I'm just going to try to touch his ears with his feet. Nice. So that's another full-term baby sign. And now I am just going to check how active he is, and he is squirming his hands a little and his feet, so that is fine. So now what we're going to do is just flip him over and take a little look at his bottom, and the little folds, these folds are equal, so that's good. That means he's equally active. He's not just active on one side. And now let's move him back, and we're going to check for Ortolini. So that I'm just going to be moving his little hips in a circle and making sure there are no clicks. And I heard no clicks, so that is okay. So now I'm going to listen to his back real quick. So let's flip him over. Okay, that's his lungs sound great. So now we are just going to check the spine. It's nice and midline and straight. And now we're just gonna do a little tickle on this side, and you see how he moved. And now another little tickle on this side, and he reacted just fine. And he has no dimples, so that's fine. And I'm just going to turn him back over. And now we're just gonna check his grasp. So I'm gonna see if he will hold on to my fingers. Oh wow, he has a really tight grasp. Awesome. And so now I'm just going to check his little foot and trace it. You see how his fingers just flare up? That is so cute. That is what we want to see. And now we're just gonna pick your baby up and see what he does with his feet. Oh, how cute. Look, it's like he wants to walk already. So this is just the reaction we wanted to see. And now we're just gonna, we have a few little things left. So now we're just gonna check for this thing called tonic. This is where the baby faces this way, away, and then his arm, you notice how his arm is straight forward, looking like he's gonna fence on guard. Yes, so that is perfectly fine. That's what we want to see. This hand is curled and this one is facing. Okay, so now we're just gonna repeat it onto the other side. Perfect. And for flexion, you see how he just goes back to his fetal position. That is completely normal. And so now lastly, what we want to do is monitor for any crying, and you have such an amazing baby that he's not crying, so I am just amazed. So that pretty much sums it. I am going to put little baby boy back into his burrito. And everything looks awesome. Yes, you have an amazing child. Would you like to have your baby? Would you like me to hand you your baby? Maybe you can nurse him or just bond with him, or would you like to relax and I can leave him here in his crib? Okay, you would like him? Okay, here he is. And I'm just going to raise his crib and put the side rails back up in case you want to put him back. Okay, ma'am? So, everything is looking great. I'm just going to go ahead and document all my findings. Is there anything else I can do for you? No? You're good? Okay, well, I'll be around, and even if you don't see me, I should be peeking in within like 20 minutes. But if you don't see me, just go ahead and push that red button and give me a call, okay? Awesome. Well, ma'am, enjoy your beautiful baby, and I'll see you whenever you call me, okay? Thank you. So now that I'm done with the patient and the mother, now I'm going to document all my findings.